Hello there and welcome. Today, we're going to get to the bottom of a really common but oh so frustrating problem. Those painful little cracks that show up right at the corners of your mouth. In this explainer, we're going to unpack exactly what they are, why they pop up, and most importantly, how you can finally get them to go away. I mean, haven't we all been there? You go to eat, you start to talk, or you just try to smile and bam, you're hit with this sharp, stinging pain. It feels exactly like a tiny paper cut that just stubbornly refuses to heal. If you're nodding along right now, trust me, you are in the right place.
So that annoying little condition actually has a name, angular cheilitis. Now, I know it sounds a bit intimidating, but here's the good news. While it's super uncomfortable, it's really just an inflammatory condition, not something dangerous. Think of it like your skin raising a little red flag, telling you that something's just a bit off balance.
All right, here's our game plan for today. We'll kick things off by talking about the problem itself. Then we're going to play detective and look at the 5 main culprits behind it. After that, we'll cover how to spot the signs, dive into a super clear treatment playbook, and wrap up with how to keep it from ever coming back. Sound good? Let's do it.
First up, let's just acknowledge the real-world impact of this, because it's so much more than a tiny crack, isn't it? It can really get in the way.
For sure. It messes with the simple things, the good things. Taking a big bite of a burger, laughing out loud. Even a simple yawn can suddenly become a really painful moment. It's just this constant, nagging reminder that something isn't quite right. Okay, moving on to section 2. Look, to really solve a problem, you have to understand what's causing it in the first place. So let's investigate the 5 main reasons you might be dealing with angular cheilitis. Figuring out the why is absolutely the most critical first step to finding a cure. So, the number 1 culprit is pretty interesting. It's not some strange foreign germ. It's actually an overgrowth of something that's usually already on our skin. We're talking about Candida, which is a type of yeast. It just loves warm, moist environments, so when the corners of your mouth get a little too damp, it basically throws a party and multiplies, causing all that inflammation. Then, bacteria like staph can see those little cracks as an open invitation and decide to join in, making a bad situation even worse. But wait, what creates that perfect, damp environment for these germs? Well, it's excess moisture. I know, it sounds backwards, right? You'd think more moisture would be a good thing for your skin. But when saliva pools at the corners of your mouth, maybe from a habit of licking your lips or from something like dentures that don't fit quite right, it creates the perfect little breeding ground for that yeast and bacteria to go wild. Okay, because cause number 3 takes us from the outside in. You see, your body is a whole system, and your skin is often the first place to show you that something's up on the inside. If you're running low on key nutrients like iron, vitamin B2, or zinc, your skin's ability to repair itself and fend off infections is seriously weakened. It's kind of like trying to build a strong brick wall, but you're missing some of the most important bricks. Culprit number 4 might be your skin itself. If you already deal with a skin condition like eczema or psoriasis, your skin's natural barrier is just more vulnerable to begin with. And sometimes the trigger is an allergic reaction to something you're using every single day, like a new lipstick, your favorite lip balm, or even your toothpaste. And finally, our 5th major cause, your body's own defense system. If your immune system is working overtime or is compromised, maybe from a condition like diabetes or from taking medications like antibiotics, it just has a tougher time keeping those opportunistic little germs in check. All right, so now that we know the potential causes, let's talk about identification. How can you be sure that what you have is actually angular cheilitis? Catching the signs early is your best bet for stopping it in its tracks before it gets any worse. So here are the classic signs you want to look for. It usually kicks off with just a little redness and discomfort. Then you might notice those small cracks or splits appearing. The area can start to feel really dry and then get flaky or even a little crusty. And that burning feeling, especially when you open your mouth wide, yep, that's a telltale symptom. If it gets really bad, it might even bleed a little. Okay, we've identified the problem, we know the causes, now we get to the best part, the solution. Welcome to your treatment playbook. These are the real, actionable steps you can take to get some relief and start healing for good. So here it is, the 5-step plan to get you back on track. Step 1, you directly target the infection with medicated creams. Step 2, you take away the moist environment that it loves. At the same time, you'll want to build up your body's defenses from the inside. With good nutrition, protect that healing skin with a barrier balm, and finally, take a look at any underlying health issues that might be playing a role.
Now, this first step is absolutely crucial. You have to use the right tool for the job. The treatment that's going to work for you depends entirely on what's causing the problem. If it's fungal, you need an antifungal cream, something like clotrimazole. But if it's bacterial, you need a topical antibiotic like muprosin. Using the wrong one just isn't going to work. So figuring out the root cause is everything. Let's do a couple of rapid-fire questions that people ask all the time. First up, the big one. Is this thing contagious? Can I give it to somebody else? And the answer is, well, it's a little bit of a yes and no. The condition of angular cheilitis itself isn't contagious. But the germs causing it, the fungus or the bacteria, can be spread. So while you're not going to spread it like the common cold, it's probably a good idea to not share things like lip balm or drinking glasses until you're all cleared up.
Next question, how long is this going to stick around? What are we looking at in terms of a healing timeline? And the good news here is that you're not signing up for a long-term battle. With the right treatment that actually targets the root cause, you should start to see a big improvement in just a few days. Most cases are completely gone within 2 to 3 weeks. Just stay consistent with the treatment. Okay, healing the problem is great, but you know what's even better? Making sure it never comes back. So in our final section, let's go over some simple habits that can keep the corners of your mouth healthy and happy for the long haul. You'll notice that the best prevention tips directly fight against the causes we talked about earlier. Good oral hygiene keeps bad bacteria from taking over. Using a simple protective lip balm creates a barrier. Breaking that lip-licking habit is a huge one. And making sure your diet is packed with those key vitamins and minerals, that keeps your skin strong from the inside out. You know, I think this final thought from our source really sums it all up perfectly. Because this is such a common issue, it's so easy for us to just brush it off as, oh, it's just chapped lips. But it's not. It's a specific condition with specific causes that really need to be addressed. If you ignore it, it's only going to get worse. So I'll leave you with this final question to think about. After everything we've covered today, from breaking a lip-licking habit to adding more zinc to your diet, what is one small, totally doable change you can make starting today to protect your smile? Because it's those small, consistent steps that lead to long-term health and, of course, a pain-free smile. Thanks so much for joining me.